I'm Ruth Stewart, and I am one of the 5 original founding members of the School of Nursing. Very interesting time, of course, and it's been interesting ever since. That was 1969, and I retired 25 years later in 1994. The roles I played during that time or the opportunities I had to start new programs and do exciting things were just innumerable. But my area is community public health. And for those of you that might wonder about that, that's working with the community, working to prevent diseases and illnesses and injuries, and not just remedy them after the fact. So it was an interesting time to come to San Antonio, new to San Antonio, new to Texas, and certainly new to this brand new school, which was exciting. We did a lot of changing through those years, great many, of course, in terms of the type of curriculum design we were using and the type of organizing of the faculty for those programs and various things. But basically, my area was in the community, and my clinical experience with students was all in the community in relation to promoting better health for the community, working in schools, working with the health department, working with families in their homes, and the interesting kinds of things that we could do because we weren't constrained to hospital or clinical roles within that situation. So then I also got very interested in politics because of nursing, although I'd always been a voter and a letter writer. But about that time was the time when the nurse practitioner ideal was coming to the fore. And I had had experience as an embassy nurse overseas doing primary care as best I could with a Merck manual and a prayer for the people in the embassy and their families and their help, anybody that was related, and the people and the local people in the embassy. So I had the kind of experience before the nurse practitioner ideal was evolved in my alma mater, University of Colorado. So I had all this connection, and because of the need for more of that and funding for the kind of programs needed, and the approval of it in political situations, policy roles, I started chasing around the community, talking to city council, to commissioner's court, to the local legislators, running to Austin whenever it was necessary, but mainly within the community, visiting with the people in their own settings here. So it was because of that that then I also developed an elective in health policy and here at the school, and taught it pretty regularly throughout, and hopefully got students interested in doing something about the kinds of things that make a difference in healthcare, in health status throughout. So the theme throughout of all my experience at the school and in the community was community and political action. And it still is, as a matter of fact. So that I have remained active in the Nursing Association, Texas Nurses Association, and the local group as much as I can. We have the Governmental Affairs Committee meets here regularly, monthly, so that I can be part of it, but also they have a place to land for the meetings for that purpose. So, and I'm very active in various local political groups too. So it's all going on. I haven't really stopped part of it. I'm not running around a lot, but I'm still involved in a lot of that, and am gratified when I know that students have gained some of that, and it comes back to me, and they see me or call me or write me and say something about the impact that this experience in political action in the community has had from their lives. So that's basically the overall theme of my time at the school. That was through Texas Nurses Association, yeah, and Governmental Affairs Committee, which I was on and chaired at one point, and then when I went on the Board of Health, State Board of Health, which was, of course, a political appointment, so it was kind of a conflict. So I no longer was officially a part of GAC, Governmental Affairs Committee. And then I was continued for years as a special advisor, an unofficial special advisor to the committee in Texas Nurses Association, and it was with that we got started doing the legislative day, which was great. I continued with that for as long as I could get around without a walker, so I don't do that anymore. In some ways, it has evolved very importantly, as in the nurse practitioner aspect, although that's not really public health. It's in the community. It's working with families or people in various settings, offices, industries, schools, or whatever. But it also is becoming so recognized that working with people before they get sick is important. It used to be that the doctors and the hospitals all thought, and many nurses, that the only thing to do was take care of sick people. Well, public health is the opposite, complete opposite of that. It's getting people before they get sick and work with them to do the kinds of things or help them see the kinds of things that help them from getting sick along the way. And a lot of this is like with kids in school and getting teachers involved with that. And that works out more and more. And of course, here now we have a healthcare health careers high school. I think that's a term of it. And so there's a complete effort towards getting people into health at the very early age of a very early part of their education. So they're thinking about this. But again, a lot of this gets them thinking, mostly what they think about when they're going to that school is sick care. So it has to evolve from that into what do you do to keep people from getting into this bed in this hospital, that sort of thing. But it's sort of difficult to describe, really, other than that, as a preventive teaching situation throughout the community. And working with policies, going to Austin, going to Washington, whatever, or visiting, don't even go there, just visit the legislators in between sessions in their own office here or wherever, having coffee in a coffee shop, the kind of things that we do quite often. The policies, actually the state policies, affect more of healthcare than Washington does. Washington ends up affecting a lot of it because of their funding mechanism. When any institution that wants Medicare or Medicaid money has to settle for some rules out of Washington, policies that Congress makes. But basically, the certification, licensure of hospitals, of all healthcare providers, nurses, doctors, physical therapists, nutritionists, the works, come from the state. The daycare centers, because of the health situation in there, affects very directly the children involved there. Restaurants in the community, those rules for them come out of the Austin. And the my students in public health had a great time going out with sanitarians from the health department to see how they checked food and temperatures in refrigerators and freezers and in dishwashers to be sure that everything was safe. And we had some wonderful sanitarians. Actually, I learned a lot of my public health from sanitarians that I worked with in the early days. But those laws are often managed or mangled by those that have a financial interest in reducing the amount of regulation they have by the state or the feds. So it's always an effort, but it helps to have nurses going in. Everybody loves nurses because they never know when they're going to need one. But basically, to have nurses show up and start telling them about the kinds of things that are important in our community or our state does make a great difference to that. And I'll never forget the first Nurses' Day we had, and going up in an elevator with several of my peers, and with our name tags that said we were nurses. And these legislators giggling to us and saying, "Now who's taking care of the sick folks, people?" So we started right there. But it is important to have the trust of those that are writing the legislation, or at least work with them as best we could to modify whatever it is that they're affecting. Not every committee has an influence on what we're doing. Not every legislator has, but every legislator eventually votes us up or down on certain policies. So we work with all of them. And in this case, we work with both parties or whatever else people might be there. The kind of things that I was doing here were unique to this school at that time. Now more and more, and in fact, the fact that we have Nurses Legislative Day, they bring in students from other schools in the state, but they have to go through certain orientation to be accepted to this program, because we end up with more than we can handle. I say, I'm very possessive about all this. But anyway, then they get some of this that way, and hopefully more of the faculty are becoming really cognizant of how important all this is throughout everything they do. But it's not been a thought in the past of what needed to be done. It was just there, for better or for worse, and usually it was, or too often it was for worse. We didn't have the kind of support we needed for the proper legislation. And if you know anything about history, then you know about the fires and the shirt-making women in New York that burned up because of there are just so many things that's the policies involved. No longer can they lock doors and lock people in their workplaces or not let them out to do whatever they need to do, get a meal, get a stretch break, that sort of thing. So these things aren't always popular. They cost money for whoever employers are, or they think it does. It doesn't in the long run, as far as I'm concerned, because if you have healthy workers, they're more productive. They don't take sick leave. They don't need or lose days. They don't even have sick leave in most cases. Here we don't, for a lot of situations. And the reason we have very inexpensive restaurants all over town, all these little mom and pop restaurants, is because they're not regulated. They don't have health care. They don't have sick leave. And it's just take what you get, But this is the kind of thing that our sanitarians try to at least keep the food safe. But there's not, in the state, all food workers have to have a TB test tuberculosis. So that's one thing, but that's just basic. And there's so many other things. If common cold can be passed on so easily by someone. Well, that's because of Dean Patty Hawken. When she first came, I obviously had been involved in some way because having come from the get-go, I was very interested in that we keep some of this going as to what we'd been doing, what we did differently, that sort of thing. But Patty, just very early, picked up on my interest in it in some way, and she provided me with a summer semester to do the history up to that point, realizing, well, she'd come from Case Western, and she said they had done some historical research there, or maintenance at least. And so she did that, and I was doing all sorts of interesting things like that, and I was interviewing and audio taping people. At that point, we didn't have the resources for anything more than a little tape recorder. But one of the legislators that helped to get this school started that's another policy thing. Austin set up this school as the third component. Austin was and is the mother school, and at that point there was also, it had come from Galveston, but Galveston did not have a academic program. It was strictly a hospital. They'd had a nursing school from the 1800s, but that was where the nursing part started. Austin had the academic program, and when they wanted to start a master's program in University of Texas, they had these two components, the clinical part in the hospital in Galveston and then the academic part in Austin. Then they wanted to expand further throughout the state, and we were the third component then added. And I like starting things. That's why I came here. I mean, it's not the only reason I came here, but that was the thing that first attracted me. And then the people in Austin that I talked to, and the dean, Greta Stiles, was already appointed as dean, and this was during the year. We came on our Easter break, I think it was, spring break, and I met her there in Austin, and we just hit it off, and I liked all these people. And they liked me, I guess. Here I am. So anyway, but that was the way we got into history, was just getting started with the fact that this was a brand new school. There was a lot to maintain. Patty saw the need. And so I had just the curiosity to go around and chase down these people and get their viewpoints on what had happened and what they'd had to do to get the legislation passed and to get the community involved. And they did. The Chamber of Commerce and various groups like that, they had had the wisdom to get people like that involved in it. It is community effort. It goes back to community, no matter what you'd want to call it. If you don't know what's happened, you may repeat the past to your detriment. And if you maintain what's been going on and can see improvement along the way or see ways to improve, which we did all the time. We were always, that's part of why I liked this school. It was always something new to try. We did constantly change as needed because there were national changes in terms of health care. There was national policies, including like when Medicare and Medicaid came along. That would make a difference because more people went to the hospital, for one thing. But then they didn't want them to go to the hospital because that cost more money. So then we get back involved, and that's when we got heavily involved with nurse practitioners and public health in the community or public health. So there's just a lot of reason to maintain the history. The history is, I just feel that women's history and nursing history have been neglected tremendously. And starting with both of those, and with nursing, it involves both, because Originally, there were no men nurses. The reason we got rid of caps, by the way, in nursing uniforms was because men started coming into nursing and they weren't about to wear those caps. So, I mean, history evolves along with the changes in the community, the changes in people and their interests, and the policymakers in their recognition of different needs. So it just seems so obvious to me that the history is needed along the way. How do you know how to get more money from the legislature if you don't know who plays up there, who helped you in the beginning, what they responded to because of our history, or who in our history? I think that excellence was imbued in everything in the school. The leadership just promoted the idea that we had to be good. We had to do the best we could with students. We had to make the community recognize that there was a nursing school here. To begin with, that was a big job. And but UT, the term UT carried a lot of weight because, of course, it had a football team. We didn't here, but the football team is known throughout the Texas for sure. But the excellence really was started from the top and carried down in opportunities to explore different areas, new types of curricula, or new research that might be applicable to nursing, to healthcare, to people's health, basically, and to the community at large. So it has to be something that's in a sort of a spiritual sense, actually. You don't just teach leadership. You just don't teach excellence. It either has to be a part of what's going on every day, in every way. I'm being effusive on that. We're not all perfect, and we didn't always do all these things perfectly every day, but there was a general effort to keep that momentum going and see ways that we could change to do these things, which goes back to history. But I do believe that the faculty that were interested in any of these areas, and sometimes more than one area, were given the opportunity to pursue what would foster this and help the school and help the community, help the students, which go out and help the community or the world. We started out with sort of a nondescript curriculum, I guess you'd call it at that point, but moved in with the system school, Austin at that time and Galveston. We later added El Paso and Arlington, Arlington and then El Paso. But and then we went into what we called integrated. And the idea makes a lot of sense, but it just didn't work out that well. But this was a national trend. But we were following on that, or among the leaders, actually, probably. But integrated curriculum brought together, for instance, community, public health, along with psych, because everybody you contact has some problem in one way or another. And maternal and child, because we're working, that's a great place to start prevention, is with women and children. And so you integrate all this, and you're sort of teaching all these things along, one strand along with the other. But eventually then it ends up with something being completely lost. And community was one of those things that we started losing out on because the more clinical aspects seemed to take more time and effort on the part of faculty and students. But so that was changed then, and we went on to other kinds of general frameworks for our curriculum. We were always developing new curricula in our school. And that became sort of ugly part of the thing at that time among faculty, that we were always changing. Well, we needed to change, and you have to change to keep up with things. And part of keeping up with them is the state board exam that every student has to take to become a licensed nurse. So, and that's, again, policy. Devastating initially, truly devastating. It was a political move, and it just seemed like the whole world had fallen apart at that point. And yet I knew, and I remember talking to Dean Wolanin, Dean in Austin, Dean of the whole system at that time, that we couldn't win, because if we couldn't win or we couldn't lose either way, because if we made everything work without the system, they'd say, see, you never needed a system. But if we failed, they'd say, well, the system kept you together and you just fall apart if you don't have the system. Well, we didn't. We managed. We obviously managed. But as a faculty here, and I'm sure the other campuses were pretty much the same, because our system-wide, we always had system-wide curriculum meetings. We always had system-wide faculty meetings. We did things as a total group. I don't know whether that would have worked today or not, because our faculties are all so huge, not bigger than on any of the campuses. But we did. It was a very congenial atmosphere. And again, leadership from the top went with it. And so I imagine it's sort of like that if you have a divorce in a family. You know, everything seems like it's going to go to pot at that point, but then you pull together and do what you can with it, and it carry on. And we succeeded. We certainly did. And the others did to as much extent as they could. And of course, we don't even know at this point in the same way. So, but it was, the system was very effective politically, because by the time we had campuses all over the state, from El Paso to Arlington, Galveston, here, as well as Austin, the mother lode, if you will, then we had political influence in all these, coming from all of these directions. And so legislators from all over the state were very interested in keeping nursing schools going at that point, state UT nursing schools. So it just was something, and that was exactly the problem. It gave the school too much power politically for those that didn't want nursing to be that powerful. You know, I don't remember much about it. We just moved. We were all hilarious because we'd been in this temporary building without a bathroom in it. And then we get into this lovely building. We drew numbers to get the choice of offices. Number one got the first choice, and I think I was 30 or something. No, we didn't have that many faculty at that point. But anyway, that was a very democratic way to select our offices. And we had the full learning lab then in the basement of that new school, and that was a very positive aspect, because in the temporary building we were limited in a lot of ways, not as much space as just not the facilities like water. Even for a learning lab, you need to be able to wash hands and do some of these things as basic parts of the routines. So anyway, we were very excited about the move, but the system took care of us moving over there. The system did a lot of things. That was the total system, though, not the nursing school system. It was just that, and all our room numbers were numbered, and anytime anybody got lost in the building, we'd just say, the system's fault, it's not ours. because those numbers don't make a lot of sense. And by the way, the generation of the Health Science Center was a whole new concept along there someplace, because there were medical schools and dental schools and nursing schools. And, I don't remember that part of when that took place, where it generated into a system within a Child Health Science Center, probably about that same time. Somebody needs to be a better historian than I am. You can provide information, historical information on leaders and what they did. And boy, do we have it here in Texas. We had one of the first nursing practice acts in the country, in the whole country, in 1909. Very early. I think only North Carolina had one that was before that, but ours at that time had all nurses on the board, all licensed nurses. Whereas the one in North Carolina, I think, had hospital administrators on it. And so that's a whole different perspective, in terms of what nurses really need all the way. And they don't care about leadership in the hospital. They want warm bodies taking care of other warm bodies. So anyway, but the leadership is something that, again, it's just a part of what some people carry on, and people that become faculty in nursing schools, or more than that, even deans, are just by nature wanting to be leaders of the new generation of what's going on in healthcare, what can be done. And I think that that's just a part of what's going on. And I've always felt that we were fortunate in faculty situations, because at the end of every semester we had a break that then we reviewed historically what we'd done and what we'd done right and what we'd done not so right. And in the hospital, they don't have that. They just keep going on day by day by day, unless there's somebody in the situation someplace that says, let's stop and take a look at what all we're doing or not doing, or getting some feedback from outside some way. But we were fortunate. I mean, that's every school, not just ours. That's a part of education, because the students need the break before they go on to the next session. If there's no leadership, things just don't get done, period. You have to have somebody that organizes, that visions what could be done better, what is bad about what we're doing. I can remember in my student days 100 years ago, when we took temperatures on night duty at 5 o'clock in the morning. We woke up the patients to take their temperatures, to wash their faces, have them wash their faces, that sort of thing. Finally, somebody came along with the vision that, why does this have to be done? Those patients need their sleep too, or they need whatever's going on routinely. So research has come into this, and research has demonstrated that this isn't just to intuition, that people don't need to be awake at 5 o'clock in the morning in the hospital. You do the research and find out what difference it makes one way or another. No, it doesn't. So we go on. There's just endless kinds of things in the practice that need to be taken care of. And it's the research that goes on in academia that then carries over to the practice and helps promote better nursing care in the situation and leadership within the nursing practice areas, so that things can be improved, patients can be better lifted, can be better turned, they need to get out of bed the day after surgery instead of staying in bed for 3 days or 5 days. These kinds of things but they need to have somebody, a glimmer in somebody's eyes that something needs to be different. So they try out certain things, and then eventually it gets into a pattern of what is done better for everybody, including not getting people in the hospital to begin with. Why do they need to come in, or why do they have to stay an extra day? Yeah. Well, it was before certain committees, so it wasn't all of Congress. I don't remember which committees it was, but that was because of Texas Nurses Association and working with the National American Nurses Association. And that was because of foreign nurses being brought into the state. Here in Texas, we had multitudes of foreign-trained nurses that would be brought in by hospitals, and they were virtually indentured servants because if they didn't work there, if they left, they had to pay their own way back to wherever they came from, and they didn't have any money, virtually. But on the other hand, they weren't licensed here in this country, in this state, at that time, because they just were brought in and they were labeled graduate nurse or clinical nurse or anything but RN. We now have a law, I was involved in working with that through TNA, that requires that anybody that is a RN or an LVN has to be labeled during their work hours. And it really ticks me off when I go in someplace to visit a friend and their nurse doesn't have visible licensure information available on them. But that's one of those things. But I went to testify in whatever committee it was quite a large committee, I remember, that about why this was a problem to healthcare, to nursing, not just the nurses themselves that came from India or whatever, a lot of them from Philippines. But it was difficult for them. They were in a bad situation. But the patients didn't have any, and the nurses, our nurses working with them, didn't know what their training was, didn't know what they could or couldn't do. So that was again part of my political involvement. Then I went to Washington to tell the committee what a problem it was. In fact, one of our congressmen that really promoted this, local congressman, was more interested in keeping them out for other reasons, not the same reasons I was, but we worked together. You give and take a lot in this scheme. Again, it was just sort of the leadership idea. She and her husband retired here to what was then called Air Force Village. It's called something else now. But she was wonderful. She would come to the school and talk to groups, student groups or faculty groups, about the impact of nursing research and what it could do to improve the practice. And just because she had been there and done that in the very early days, and she just exuded wisdom. And she was just wonderful. But that was it. It wasn't an official role by any means, but because she had retired here, lived here, we absorbed her.